This book, it is having a description, pictures and summary. How you have to read this book is, we want only histology, we are not writing exam in anatomy. We want histology to apply it to pathology. So I am going to do only applied aspect of the histology. And this image is very, very important because in pathology, we are seeing two-dimensional images of a three-dimensional thing. Okay, that's very, very important to understand. See the egg here. If you cut here, you may see the big piece like this, where you can see the yellow and the white. And when you cut in this level, see, you will see only the white. You may not see the yellow. Okay, and when you cut tangentially like this, you will see a circle. See the same egg, how here it is seen as a oval, here it is seen as a circle. So this is the same egg, but what way you cut. Okay, so this is very, very important. There may be a spindle cell, okay, and a nucleus here. When you cut here, it will be like round. When you cut here, when you cut here, it will be like longitudinal, like this. Do you all understand? If you don't understand anything, please let me know. These are all very important things you have to understand. Then only you can enjoy seeing the tissue in the microscope. Okay, and this is the egg they showed you. I think in the bottom they have shown an appendix. If you cut the appendix like this and you invert it and see, you will see a long thing. But when you cut here, it will be seen. Lumen may not be seen. You will see only the cells. And if you cut obliquely, you will see a oval piece. If you cut tangentially straight, you will see a round piece. If you cut tangentially here, you will see two pieces. Probably you have to close the pencil. Can you all see the two pieces?
Yes, sir.
Yes?
Yes, sir.
So
Yes, sir.
this understanding is very, 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 very important. However, the cells are getting cut, that's how the appearance will be changing. A long will seen as a round can be seen as a long. So this under this imagination, you have to slightly stretch your imagination in pathology. So we are done. What you start doing is, the minute you take this book, you start reading. What are these? These are all not necessary. The only thing you have to remember is, each cell has a cell border, then the cytoplasm, then the nucleus. Okay, this is the cytoplasm and this is the nucleus. Okay, so only three things you have to remember in any cell. One is membrane, second is cytoplasm, and in the cytoplasm, how you have to describe the cytoplasm? Anybody? Veda?
Sir, based on quantity and quality of the cytoplasm,
Yeah,
whether it's
two
scant
Qs,
or abundant.
quantity and quality. Yes, and in the nucleus we have a set of it. Okay, there are only three things you have to see in this cell. Now you have to see the summary. Okay, just read the summary. What I need here in this chapter, in the summary, you please note it. Cell border, okay, cytoplasm, nucleus. Only 3 points. Don't read any of the other thing. Here is the second chapter, the classification of epithelial tissue. Epithelium, what are the types of epithelium I mentioned there?
Flat, cuboidal.
Okay, just 1 minute. Flat, Aparanama.
Cuboidal.
Cuboidal.
Columnar.
Columnar.
Squamous.
Squamous.
Urothelial.
Urothelial. Avladhanama?
Yes, sir.
Super. Flat means, these are all many things. Flat means it's very flat. Okay, like this. And the best example is mesothelium. For each, you remember one cell that we see it every time, mesothelium. But you have to see it. Cuboidal means slightly larger. Okay, I will tell you the criteria. That is cuboidal. Okay, columnar means cuboidal. You remember the biliary epithelium. Okay, biliary, cuboidal. Columnar, Okay, so this is the best columnar is stomach, gastric epithelium. Okay, squamous is flat cells. Okay, the best example is esophagus. Urothelium. Previously, what is the old name? Any one of you, can you tell the old name? It's called as
Transitional epithelium.
Super. Transitional. Don't mind the spelling mistakes. Okay, transitional. Why it is now urothelial? Why it is called transitional? Because the cell size and shape depends upon what is there in the bladder. Okay, if it is distended, if you are not urinated for 4 hours, it will be distended. Every cell will be flat. If you just emptied it, and everything will become columnar. Okay, they keep changing, or they will become squamous like flat cells. So they keep changing the size and shape depending upon the content in the bladder. That's why it is called transitional. But now they tell bladder is the only organ where the cells are transitional. That's why they are calling urothelium. So these are all the flat, cuboidal, columnar, squamous, urothelium. Now we will come up with the criteria. When the height and the length is 1:1, then it is cuboidal. Okay. When the height is more than twice the width, okay, 2:1 or more than 2, then it is columnar. Okay, that's how you have to apply the criteria. 1:1, height and width are the same, cuboidal. 2:1 or more, when the height is 2 times or more than 2 times than the width. Why this is important? In thyroid, there is a tumor called as columnar cell variant of papillary carcinoma. There the criteria is the height of the tumor cell is more than 2 times the width of the tumor cell. You have to know what is stratified and pseudo-stratified. So stratified means more than one layer of cell. Each cell, I can draw only 3 lines. They are all sitting on each other, and when you trace them to the basement membrane, they are not connected. Okay, this cell, for example, is sitting over these 2 cells. It is not connected with the basement membrane. Whereas in pseudo-stratified, what happens? The nuclei are arranged at different levels, and the cells are at different levels. Okay. So when you see superficially, it may look like different layers of cells. Okay, but when you trace each cell, they are all connected with the basement membrane. Usually the pseudo-stratified will have a cilia. Okay, and this is the respiratory epithelium. Now when you see, the respiratory epithelium is ciliated pseudo-stratified columnar cells. Okay, so fallopian tube is a ciliated pseudo-stratified cuboidal cells. Okay, so these are all the examples. Pseudo-stratified, please remember, respiratory system starting from the nose and then the fallopian tube, and we will come across. Okay, super. So the epithelium we are done, stratification, pseudo stratification we are done.